to maintain the health and well-being of ourselves and also the family, and the dealing with the lifestyle problems. And of course, if you have to visit hospital, is it safe to visit, how to visit, what precautions you have to take, and little bit about what is the herd immunity, plasma therapy and vaccine. And later Dr. Anita Chandra will join to talk to you about the mental health and how to stay positive. So knowledge is power, as you all know, and if we are equipped with the clear knowledge and think more about it, then it's more easy for us to own our health instead of depending on somebody else, and then we can take appropriate action. So last December or so, this human race is in war with an invisible entity, that is the coronavirus. It is significantly impacting all aspects of life, and our biggest worry is we don't know how and from where it comes suddenly. So it's a still transmission. We know how it all enters our body, but without our knowledge, it can create havoc in not only us, the entire world it has created. So we have to be more proactive than just reactive when it comes and affects us. And later we'll see how we can live and tolerate this pandemic. Corona means in Latin, it's crown. If you see here, this virus has all these spikes and they create a sort of crown around it. The worst part is inside. This is the genome RNA. That is the one which can replicate or becomes millions and millions of viruses once it goes inside the body. This is the strongest part of the virus, but the weakest part of the virus is outside. Fortunately, this can be destroyed easily with either soap or the alcohol. So that is the greatest weapon we have. But if it is able to escape us and then it goes into our lungs and respiratory tract, then we have no control over this. That can multiply inside. So that's why precaution and prevention is the most important thing, because we don't have any very good weapon to treat the disease once it is established inside. So to acquire knowledge and all, don't carried away by rumors and fake news. Best is to visit the websites of ICMR, Indian Council of Medical Research, WHO website and CDC. They give, and periodically they give authentic information. So we call it as COVID because it is coronavirus disease of 2019. That's the name given by WHO for this disease. It's a new virus which was initially found in animals, then it transmitted to human body. So it's a new novel virus. There were so many other coronaviruses earlier, like SARS, common flu, everything. So that's why this new name is given as coronavirus. First identified in China, as you all know, in December 2019, and from there it has spread all over the world. So how it transmits or it comes into human body? It's basically a respiratory tract infection. So if you can take care of your mouth, nose and eyes, and don't allow virus to enter our body through these three main entries, then you can conquer this, we can fight this. So how it happens? Basically, when you are talking loud or coughing or sneezing, it can transmit to the person across. And also, if somebody coughs and those viruses stay in the any other contact areas, if you touch that, or like handshake, and then from there, if you touch our hand into our mouth, nose, or the eyes, it can go into our body system. So that's why if you can take care of mouth, nose, and the eyes, basically the face, the greatest weapon is mask. So whenever you see that outside or go wherever, we don't know where this virus can hide. So we have to be very, very careful when we touch any of the objects and it can spread. So that's why the distance is important. And the most important symptom when it comes and affects us, it may not affect in 4 or 5 days, it may come maybe 5 days later. That's called the incubation period. Initially, most important symptom is fever or dry cough. Fever and dry cough, these are the most important symptoms, and then the sore throat or the throat getting affected or pain. And then comes the shortness of breath and other symptoms like loss of taste, all those things. So if you have dry cough and fever, then it's best is to go and see the doctor or contact the doctor by telemedicine. Like the running nose, it is more symptom of the cold, not the COVID-19. So that is, so many people with running nose, they think they have COVID. That is not correct. Other things can happen. If you see all over the world, the most important and maximum people have fever. Then is the dry cough, then fatigue, then comes other symptoms like shortness of breath and myalgia, loss of taste, all those things. So what happens if it affects us and if the virus enters the body without our knowledge and starts multiplying? Most people may recover fully. So many people already may have had corona or COVID disease. It may not have affected much. So people, if you have good immunity strength, it may not manifest also. It can totally, or if they develop some amount of fever and cough, it may totally recover also. Some people, if they develop shortness of breath or difficulty in breathing and body pain, high fever, they may require hospitalization. These people who are tested and found positive, they are likely to infect others. That's why the government insists they should stay isolated at home or they should be admitted to the COVID care centers. Once they are hospitalized and monitored, many of them may recover with supportive care, and some of them may develop respiratory difficulty or breathing. They may require the oxygen and monitoring very carefully. Some of them may require ICU care. And many of them come out of there also, go to hospital. Less people, very least number of people require ventilatory support, which can be invasive or non-invasive, we call it as. So if they improve again, they will be good. They may not succumb to this disease, which is rare. That means if 100 people get affected, in our country, it's about 0.8 to 2% who are getting affected. So it may be around 1% people may get succumb to this disease. So the most worrisome of this problem is the rapid spread and people have to get isolated. It's not the death which is very worrisome, but because of the isolation and the problems associated with this and also how it can spread very fast. So the young people and who are good at their strength and immunity, they may not suffer much, but the high risk group, they are the ones whom we have to protect and we have to be very, very careful. People above the age of 60 or 65 years and older, they are the ones very vulnerable to severe disease. Then people with chronic lung diseases, asthma, chronic smokers, and people who have heart conditions, severe heart disease, and who are immunocompromised. When you say immunocompromised, means their body fighting strength is less maybe because of the cancer treatment, like chemotherapy, radiotherapy, chronic smoking, bone marrow or organ transplantation like kidney or liver. And there are some HIV, AIDS disease which can reduce our immunity. And people with very obese people whose body mass index is more than 40, they are also high risk for severe disease of COVID. People with diabetes, again, they are under the high risk group. Type 2 diabetes or type 1 diabetes, they are also, we have to be very careful. People with chronic kidney disease undergoing dialysis, people with liver diseases, all these are high risk groups. We cannot manage them at home. They are the ones, if they develop any symptoms, best they should go to and take care in the COVID care center or the hospital where facilities are there. So this is how it enters and what symptoms. Then let us see how to protect ourselves and our loved ones from corona. So we have to take care of not only us, our family members and our friends. So we all suffered during the period of lockdown, and also it's happening on and off. So burn if you must, but rise from the dust. So we have to come out of this and see that we win over corona. Entire world is at crossroads, so it is not affecting one person or two people like that. So let us not worry too much about some people getting affected in our family or not. It is the entire world which is disrupted. There's uncertainty all over. Economic impact is very bad. And this year only, and maybe next year also, only we can think not about growth, achievement, honors, all those things. Survival itself is a great achievement. So we should see how we can prevent this and how we can survive this pandemic. Then everything will be all right. So as I said, this is the membrane, phospholipid membrane, which if it is broken, then the virus gets killed. So the best thing for that is to wash our hand. We have the best weapon, that is soap, the good old soap. This can kill and remove this outer membrane. So wash our hands frequently. If you are outside, soap is not available, then we should use this alcohol-based sanitizer, 70% alcohol-based sanitizer. That also can damage this. Once it is disrupted, then it cannot invade into our body. If it is in our hands or in our face or anything, best is to wash it away and then it get destroyed. It will not enter our body. So these are the preventive measures, the frequent hand wash, and then avoid touching face, especially the eyes, nose and mouth. Keep distance. If you are working inside the office, keep a distance of at least 6 feet or so from your colleague, and they should also be wearing the face mask. If you are outside also, face mask is a must. And if they have cough or sneezing, should not be done without a hanky, or if you have no hanky or tissue, best is to sneeze or cough into our elbow region where cloth is there. And if at all any symptoms are there, we have to stay isolated at home and call the healthcare worker if you are unwell. Now there are a lot of telemedicines are available. So dear friends, our weapons to fight corona are very, very simple. Only thing is we have to practice it, and maybe we have to practice for another 1 or 2 years also. That is the mask. We need not wear expensive mask and the N95 mask or anything which medical people have to wear. Second thing is hand hygiene, and don't touch anything outside where we don't know where virus will be sitting and who has coughed and touched and gone there, and keep social distance. If we do this much, definitely we can win over this virus. If you see this, the effect of mask from 100% risk to we can reduce it to 0% risk if we carefully practice this. We have to wear mask and keep at least 1 meter or 6 feet away from other people. So because we don't know who has got this COVID disease or not, many people, they may not have anything. They may not have fever, they may not have cough. These things may come after 5-6 days. So best is to take care and wash your hands at least for 30 seconds frequently. If you go out or touch anything, best is to wash, otherwise use sanitizer. Third thing is don't touch. There is no point in shaking hands, touching others. All this is gone now. Best is to distant socializing and namaste from a distance. Whole world is adopting it. And this is what I said. Keep distance, social distance wherever you are. There is, except your family members inside the house, other people, we should be away from them and they should also be wearing the mask. And wearing the mask appropriately is also important. There is no point wearing mask and it is sitting on the neck and not, it's not covering the mouth or nose. So this is very important. Each of you should educate all your friends and relatives and others that if you are wearing a mask, it should be properly worn. It should cover the nose and also the mouth. If it comes and goes up, again, they may get infected because viruses may be sitting in the neck and then that can get affected. So mask is the greatest weapon for all of us, and you will be seeing this, everybody wearing mask for longer time now, maybe another 1 or 2 years or maybe later also. So friends, most important 5 do's I can say to save ourselves from corona is protect your face appropriately with mask. Don't allow virus to go to your lungs. So in between taking out the mask or anything, better not to do that. Hand hygiene. Then think every person as possible COVID positive. So you may be very close friend, so outside, but it's better to keep a distance, better to talk to them by phone or any other forms like webinar or Skype, and keep updated on COVID. This is again very important because it's a new virus, new disease. The knowledge of the entire world is very limited. Things are changing very fast. What we knew in December, January is entirely different now what we understand now, and it is going to change further. So we have to be keeping updated by visiting the ICMR site, WHO, and also the CDC guidelines. So if I say important steps to prevent acquiring or spreading this virus, social distance is very important. So avoid contact with people outside home, avoid non-essential travel, and better to avoid public transport, better to use your own transport. If possible, better to avoid driver also. Avoid public places, parks and crowds, family get-togethers, but keep in touch with friends and relatives using your social media or phone. Avoid routine visits to hospitals, labs. You can use telemedicine facility. If it is necessary for the second or third consultation, you can go. Hand hygiene, avoid handshake, touching face, and then wash your hands periodically. Alcohol-based hand sanitizers. Avoid touching possible contaminated area objects. Better not to use public toilets these days, door handles, the lifts, all these things may contain this virus, and wear mask, which is very, very important. So I think we covered most of the things. So with all these, somebody gets COVID-19, what they have to do? First is don't go out, stay at home and call your local health service, inform them and take help from others, and also keep distance from your um, family members. Better to stay inside a room where all facilities are there. And also if there are older people, better to send them away or stay away and protect them, and take plenty of liquids, and if there is fever, paracetamol, and keep yourself hydrated, very important, and take help from the medical or healthcare personnel. So it can transmit, virus can transmit from one person to another by the means I told. So symptomatic transmission, that means when the person has fever or cough, they are highly contagious. They can spread to so many other people. When they don't have any symptoms, again they are possible to transmit, because symptoms may occur up to 5 days or 14 days later. Some of them may not have any symptoms. They may be just walking on the road. They may be your friends. So only when we do COVID test, it may come positive. They may not manifest any symptoms at all. So that is why it is spreading so fast all over. So this is like this, viruses may be there in the air, and if we can see them, I think we would not have gone outside home, but where these are invisible, microscopic enemies. So that's why we don't know that there are so many of them. They are outside. So it's best is to break the chain, to stay home as much as possible, work from home till all this settles down. So as I said, there is video or teleconsultation available. So better to get acquainted with them and also take help from the healthcare facilities. So next point, just if you are sick and you not only the COVID problem, other diseases, whether you can go to hospital, what precautions you have to take, whether if there is a surgery required, whether it is safe to undergo surgery. These are the some points I was told to cover. Every hospital now has a COVID review committee, or the personnel who are managing the hospital. They are very periodically reviewing the policies, what newer thing has to happen. And there are specialists in this infectious disease, specialists, pulmonologists, physician, and many times we all do the virtual multidisciplinary team meeting to decide. Every week there will be upgrade of knowledge, healthcare workers are trained, and lot of information is given periodically so that patients won't suffer. If you see all over the world, it is the healthcare personnel who are affected very much by the COVID disease. So if all WHO says there are 10% of global infections are affecting the healthcare workers, whether it is nurse, doctors, or the ayahs, or the ward boys, everybody is, because that's where the battle is going on. So this unprecedented occupational risk for these people. A lot of people are suffering, a lot of people have died, and still it is not able to control. So there is shortage of even healthcare personnel, and working with all these PPE and exposure to these things are very, very difficult, and it's a very difficult area. And the time for the healthcare personnel also, many times they cannot go to their own home. They have to stay outside, isolated, and then after the period they have to go home. A lot of problems every profession is facing, and basically the healthcare workers are facing it much more. So every hospital has modified a lot of things. There are different entries for healthcare workers, people who have fever and the emergency, all these things. And when you visit a hospital, there is a system now. Initially, they encourage you to take appointment and can do initial telemedicine consultation. If you have to visit the outpatient, they will check. Only one attendant is allowed, and mask is a must, and they will check the temperature to know whether you have fever or anything. Then they can send them straight away to the fever clinic. Otherwise, if they register and then if there is no fever, they will go to the regular consultation. They can do the investigation, whatever required, and then come back. So during this time, better to have as less time to spend inside the hospital. There is no point going to the cafeteria or doing any shopping there. Best is to finish your work and come out. And every hospital now has a telemedicine facility. Afterwards, you can contact through that your regular doctor, whoever is required. So this is a small video to show to your anxiety should not be there to visit hospital, because this situation may continue for another year or two. So only thing is we have to take precautions, like our hospital and all, they have made that priority is given to the quicker registration, and also people, all social distance is maintained, hand hygiene, temperature, and also when you are waiting for something, you are not allowed to sit together. Some of the chairs are blocked, distance has to be maintained. All the areas are cleaned and disinfected very carefully, regularly. Even the elevators and all, there is distance to be maintained. So all the health guidelines are displayed. Cleaning is done very periodically. Hygiene is the most important aspect of one of our fight with this disease. Oh, sorry. Yes. All these railings, they all can carry viruses. So even in the airport also, they do the same thing, periodically clean everything. This we use sodium hypochlorite solution. Hand sanitizers are kept everywhere. You can use them periodically. So healthcare workers will wear the PPEs. So dialysis and all these things are done. They are all life-saving. We can't wait. Surgeries have to go on, and ICU care has to be taken, but we have to take a lot of precautions. All these are disposable, these PPEs and all the things which healthcare workers, we cannot reuse them, that has to be destroyed, and carefully incineration has to be done. That's why the cost also becomes more than the usual one. Not only the hospital, inside cafeteria, or also they are taking a lot of care so that there is no lacunae in the service. Number of people visiting hospital has definitely come down, because now there is only one attendant who comes, not like earlier 4-5 people coming. The people are not allowed inside the hospital, and also they have to wear mask and take all precautions when they visit hospital, so that everybody stays safe. So these are the precautions. Anyway, I have already told that if you are going to hospital, use a simple dress. There is no need of suit, tie, watch, wallet, all those things. And also better to avoid public transport, avoid touching, frequent hand wash. When you go back to home, again wash your hands, change the dress, take a shower, then only you touch your family members, and also sanitize your car key or mobile, all these things. So then the things, it should not affect anybody, it should be fine. Surgery during this COVID era, we have streamlined very much. So emergency surgeries, elective surgeries, lot of precautions and care is taken. So in good hospital, under good hands, they are quite safe. And before doing all the surgeries, routinely we do the COVID test so that nobody is affected after the surgery or anything. So a lot of precautions and discussions go on before doing the surgeries. This face shields and mask, this is not exactly for public, and this should not be done. Wearing only the face shield without mask is useless. We have to use mask and then only wear the face shield. Face shield, what it does is it prevents any direct hit, whether sputum or if somebody sneezes or coughs, it doesn't go. Otherwise, it has no great protection. But when you are in the close contact with somebody else, it may help, like in the reception desk or something. Otherwise, it's not very much required. Next point is how to boost immunity and maintain good health. There is no simple solution for this. So boosting immunity and keeping good immunity is an ongoing process. Suddenly you cannot improve the immunity of a person. So physically active, doing exercises, yoga or pranayama or meditation. Some exercise every day is very, very important so that the immunity improves. And eating right, that is most recommended is what is known as the Mediterranean diet, which contains high proteins, fruits, basically plant proteins, vegetables, fish and whole grains, and stay hydrated, drink plenty of water. So physically active and then eating right, then good sleep, again very important. Lack of sleep causes stress hormones release like cortisol and adrenaline. They may decrease the immunity. Next is you can take some of these vitamins which are supposed to give some help, that is vitamin C and vitamin D and zinc. So these are the three things which are recommended to take every day. And keep mind active, read books, write a book, something you do creative, that also again improves immunity. Distance socializing by phone or in touch with your friends and relatives so that your mood is good. Also avoid smoking, alcohol and addictive substances. So these are some of the things you can do to boost immunity. They are nothing great, which every person should do for a good health and well-being. There are so many things, other kashayam and healthy, so many things have been suggested but not validated. So we cannot talk much about them. They may be having good power, but not validated. So about the eating tips, have a meal plan, stick to it, have an eating schedule, eat together at home, and eat only in dining table or hall, eat foods that makes you full. These are all important, basically not to put on weight and become, because this battle is going to go for a long time. Many people may have to work from home. So these are the things you have to make it a practice. So one of the things we get high calories is by eating. So very, very carefully you have to eat, and most of the time better to eat proteins, fiber and healthy fat. So healthy fat are these like nuts and seeds and olive oil, canola oil, all these things, and the proteins and fibers, Also, if you have to be very cautious about your weight, better to track your weight. So auditing. So you see what you are eating, whether you're putting on weight, better to take care of that and stay active. Exercises can be done inside the home also, like skipping, or you can use the staircase of your home to go up and down. Push-ups you can do. There are a lot of mobile apps which can help you to do indoor exercises. You can do online group exercises. If there is facility, you can do gardening. And exercise is the one which keeps you happy, healthy, and a great immune booster. Stress busters. Everybody says stress, stress. I'm stressed because of this corona. There is nothing to worry. Better to have knowledge. So you can distant socializing we should do. Can a lot of things are available on the net, YouTube, everything. You can listen to music, you can listen to motivation talks, exerciser told, cultivate some hobby which you have. This is the best time to do what we always wanted to do, some hobby, and help someone. This is one thing which will definitely help you very much, giving. So nobody has become poor because of giving, and happiest people are those, or not those who get more, but those who give more. Sleep well, I already told. So taking care of comorbidities, maybe your parents or somebody else in the disease in at home, or any of us have these chronic diseases like heart disease, lung diseases, neurological disorders, or somebody has transplant and cancer treatment. They're all, we call all these are comorbidities. They are more susceptible. Nowadays, they're not able to go into hospital also. So we had to be very, very careful and support them. They should take medicines very regularly, and blood sugar, if it has to be monitored, carefully monitored. They should eat properly, exercise properly, and take help from medical people if necessary by the telemedicine, or if necessary, they should visit hospital whenever required. So in the midst of every crisis, there is an opportunity waiting. So we can refresh our knowledge, can write or publish, you can make fantastic videos now with all these gadgets available. You can teach someone, take online class, or do a webinar like this, write blogs. You can create your own YouTube channel. I'm sure all of you are doing all these things. Best time to acquire knowledge or degrees which are available online also now. Regarding testing for the corona, there are many tests, but the most important is the RT-PCR. This is the one which not 100% accurate, we can say. Now we have antigen tests also, about 70-80% accurately, we can say. So there are other tests now available to look for the antibodies, whether they have developed or all. They're also now getting available. That may become necessity later. You may have to, like if you have to travel somewhere, they may ask for this IgG or IgM antibody to know, yes, you have got the strength to fight the disease, that is immunity. So those are the things which may come. At present, what we are all doing is the RT-PCR and some antigen tests which are going on. So to look at the antibodies, it may have to come later. About the herd immunity and reinfection. Herd immunity happens when a large part of the population, they get immune to this virus. Means they may have asymptomatic COVID disease, or they might have got already disease and got immune, or after vaccination also it can occur. So still now we have not got the vaccine. So this is checked by antibody test, and these are the people who have immunity and who have recovered from the disease, they are the ones who can donate plasma. Even if with all these things, we have seen about 10 to 15% people, they may get recurrent COVID disease or reinfection can occur. It has been seen in China and also Korea. Knowledge is not very appropriate on that reinfection rate. Plasma therapy, a lot of buzz about it. The plasma is the blood component, which is we call it as immunity powerhouse in the body. It contains complements and immunoglobulins. And the people who have got COVID disease, who have successfully recovered, they can donate their plasma, which contains all these immune products after 8 to 12 weeks after recovering from the disease. How it helps is this plasma contains what is known as the memory cells. They know how to fight the disease, how to fight corona. So if we give this plasma, which have memory cells to person who has got a severe disease of COVID, so these plasma or the memory cells which was there in the plasma will help that person to fight the disease, and this basically like sending warriors to fight this infection. So they are the warriors, so they may succeed. 100% we cannot say. So how long this pandemic will continue? So this is a $1 million question. Nobody knows, all predictions only. We have to learn to live with coronavirus for some time. This may prolong, so maybe another year or two. And vaccine, even if it's so many trials are going on, by the time it comes and available to general public, everybody, it may be maybe next year or next to next year. So there is no magic bullet to treat this disease at present. So whatever happens, we can say that life will never be same as it was prior to 2019. Sort of hygienic precautions we have to take. We have to change the way we live. So how to accept and all these new normal things? There is nothing to worry. Human race has won all previous pandemics. So many of them have come and gone. And at present, best is to wear cloth mask when you go out, and mask will become an essential part of our dress code for the time being. Public transport possible to avoid. Lockdown may be repeated in small areas. It may come and go again. It may not be all over the country or all over the state. Wherever the disease becomes more active, then maybe it may be imposed. So nothing to worry about it. Manage your stress, finances. Better to save as much as possible and spend less in these difficult times. Hygienic rules will definitely continue. Better to carry a soap, towel, face mask, tissue, and if necessary, gloves, sanitizer, all these things whenever you go out or travel. Distance socializing. So that means you can do all these telehealth, telemedicine, and virtual conferences, talking to your friends and relatives virtually, but nothing to worry. This too shall pass. We will definitely conquer all these problems and then come definitely victorious. Till then, we have to sustain, we have to fight, we have to build up immunity and be active and fight this disease, and definitely we have to win. Thank you everybody.
Thank you so much, sir. It was an extremely enlightening session. Thanks a lot.
Thank you.
So shall we proceed to questions? We have quite a few of them.
Okay, Anita is there or she wants to finish off?
Yeah, she's also there. But I think, Anita ma'am, are you there? Can you hear us?
Dr. Anita? Just unmute.
Yes, sir. Can you hear me?
Ma'am, there's a lot of echo on your volume.
Ah.
Oops. Shall we go ahead with the question, sir?
Okay. Fine.
I'm sorry, ma'am. Actually, your voice is actually not very clear.
Maybe she has to remove the earphone or something.
Yep, I think so.
Okay.
Yeah, so I'll just go ahead to the questions. There are quite a few of them. I think one of them is, I think, regarding the masks. I think everybody, quite a few people have had questions about the masks. I mean, they want to know if cloth masks are good enough to repel the virus, and are N95 masks important? Like, they want to know about that. So which kind of mask can they go for?
See, layered mask, it's N95 is not required. If you are wearing a cloth mask, better if you have 3-ply or a simple mask is enough. But if you are going to visit a patient or anything, then N95 mask is required. Hospital and those things, 3-layered mask is enough. It's a very good mask available called Kavach, developed by IIT Delhi, I think. It's available in the Amazon also. So that mask is enough. It's not expensive and it's very good. Otherwise, the N95 mask and other respirators are for the healthcare personnel. Normal cloth is good enough.
Sure, sir. So the next question is actually quite interesting. So they want to know if the virus can spread from like fruits and vegetables. That is one part. The second thing is also like, for example, like mosquitoes can spread malaria. So is it similar to that? Can COVID also be spread by flies, house flies and mosquitoes?
That is emphatic no. It is not transmitted by mosquitoes or animals, dogs, or anything. So it is only transmitted from human to human via something, via the media. One is air when we are close distance. Other one is fomites. Touch somewhere, patient or a COVID person touches somewhere and he leaves the virus there, and a healthy person goes there and touches it, and then he touches his face or nose, mouth, nose, or eyes, then it will go into the body. So it is only transmission is from human to human. It's not possible as of now, human to animal. And vegetables and all, if you just wash, that should be enough. It will not spread there through the virus. And most of these viruses get will not be active in those areas, because if bring it from the good place, should not be affected. But better to wash it, potassium permanganate or simple water also enough when you bring it home.
Thank you, sir. So next question is about, again, quite a few of them about SpO2 monitors. So they want to know if SpO2 is can probably replace temperature checks, and also can they buy like an SpO2 monitor for the cows, and what kind of SpO2 monitor should they invest in?
Yeah, it's called pulse oximeter. So just don't get confused. See, the temperature check is not to check whether a person has corona disease or not. It is just to check whether a person has fever or not. Earlier they used to use meter and all. Now you can't use that. So we had a distance. That's why we are using that. It is only to know whether a person has fever. If he has fever, we have to take certain precautions. They will go to fever. They should not go inside a building or anything. They should not transmit. If just it only shows patient has fever, report and all they check, but it doesn't say patient has corona disease or any other fever also show temperature. It's only to take precautions. So the other thing, pulse oximeter. Go to checking this pulse oximeter is to check for those who have COVID disease, and just to know whether their lung becomes worsening condition or not. There is some disturbance. If the pulse oximeter shows is used only when a person has fever and is to monitor his lung condition, that is he is breathing normally. Many times we see that patient may look all right, he may have fever, but gradually his lungs may deteriorate. To check that, it is advisable to use pulse oximeter if the patient is being monitored at home. If the pulse saturation comes down, then they have to go and visit the hospital. So pulse oximeter is to check for the patient who already has COVID disease and he is being monitored at home or in the hospital. Temperature, the temperature we are checking just to know whether a person has fever or not. Okay, Deepa.
Yes, sir. Thank you, sir. The next question is about the treatment for COVID. Is there any specific treatment which is available for COVID right now, and what is being done in the hospitals currently? Like, what treatment is being given to the patients?
Yeah, this is again depends on which stage of the disease patient is. There is no specific medicine at present. So there are so many antiviral drugs people are giving. Initially, what treatment is being is just paracetamol and observing. If he goes into lung problems, then sometimes we consider remdesivir or the steroids like Dexona. And most important is to support the patient and go along with the disease. Sometimes just paracetamol may be enough. Sometimes just vitamin C and other supportive medicines may be enough, and keeping hydration. If they develop next stage of disease, then the remdesivir, all those medicines will come. But there is no particular drug which can totally bring a person out of this disease. So there is no magic bullet or a particular, like if you have malaria, you can take chloroquine. So such a medicine is not there for this COVID disease at present.
Thanks, sir. So the next question is about the spread of COVID through eyes and ears, and do they need to protect their eyes when they go out as well?
Yeah, better to wear some sort of spectacles because virus can enter our body through eyes, but not through ear. Ear, it's not known. Eyes is a mucosa. It can enter better if you wear some protective eye wear. Simple spectacles may be enough. So if you go somewhere and somebody talks and some particles may enter through the eyes also, better to protect. Most important is not to touch the eyes with your own hand. It is said that in an hour, a person touches his face about 27 times or so. So it's very, instead of other people, we have to prevent ourselves from touching our face. That's a very difficult task. Okay.
Thanks, sir. So the next query is about, so for example, there are patients who probably recovered from COVID. So can these patients transmit COVID to other people after recovery also?
So all these patients, they have been told for 15 days they have to mix with others after they recover from the disease. After that, they are safe. But whether 100% we cannot say, but after 15 days, they can mingle with other people. They develop immunity also, and they are safe for the society. They should not transmit the disease to others. After discharge, for about 15 days, they have to stay at home quarantine. Yeah.
Right, sir. Thank you. So the next query is about masks itself. So, is it okay if people wear masks and they go jogging, or they, probably do exercise with the mask on? Is it safe?
There are very good available breathing masks now. They can go for exercise, and but don't wear N95 mask and all. You can't do exercise with that. Simple cloth mask, layered cloth mask. You can do exercise. You can breathe, and you can go running also. If you are wearing these high N95 mask and all, there will be rebreathing. There may be carbon dioxide. Uh, you're You unmute, Deepa.
Sir, you're unmuted only, sir. I can hear you.
Okay. Now some noise behind.
1 minute. I'll just mute myself.
Then when you're talking, you unmute. So these simple masks you can do running, you can do exercise, everything. But outside, inside the house, there is no need of, if you are exercising, no need to wear mask. Those simple masks are safe enough to breathe and also do exercises. But N95 masks and other things you cannot do. These running and jogging and exercise and all. Okay. Next.
Yes, sir. So the next query is about GERD. So how do you kind of treat GERD? And also because this particular person feels like they're putting on weight and experiencing a lot of GERD symptoms during the lockdown.
Okay. GERD is basically acidity problem. So what you have to do is, one is good exercise daily, and also eat a lot of fruits, vegetables, and periodic food. Like morning, a lot of people skip breakfast. They should not be doing. Don't drink coffee when you get up. Eat something to dilute your acidity, like fruits or some food, and then only take. And lot of fruits and vegetables, salads will help. And less oily food, less spicy food. With all this, it doesn't come. You can take some antacid like Digene and other things that can help. If still not improving, you can take pantoprazole tablet, 40 mg daily, 1 tablet, morning 30 minutes before eating food for a month or so. But you should consult your doctor as early as possible after that, even if it doesn't come down. They may have to do an endoscopy and check it out.
Thanks, sir. So the next question, I'm just taking the last two questions, sir. There's one about a cancer survivor, so somebody who's had non-Hodgkin lymphoma in 2009. Are they more susceptible to COVID than a normal person?
2009 may not be. If they are taking any anti-cancer drugs or at present steroids or anything, then their immunity may be low. Otherwise, they should be good enough, good like any other people.
Yeah, and the last question is about vitamin tablets. There are quite a few of them. So, is it okay to take vitamin C and other tablets at this time, and is it like, is there a certain mg that they're supposed to restrict themselves to every day?
Yes, this is suggested medically. At present, you can take vitamin C tablets, 500 mg, once or twice a day for a month or two. Okay, vitamin C, that is the one. There are many brand names. Then vitamin D, D3, this you can take, that is 60,000 international unit comes. Once a week you can take for another 1 or 2 months. That will also help. And zinc tablet is 40 mg daily for another 1 or 2 months, or alternate days you can take. These three things are medically recommended to help to boost your immunity and also good health. So these are three things are you can take. If you are not want to take too many, instead of vitamin C, you can take lot of citrus fruits, whatever is available. That will also help to improve the vitamin C levels.
That's it for now, I think, sir. Thank you so much for your time. Thank you, everybody from Continental as well. Thanks for joining in for the session today. And so I think we can wrap for today.